are you fully prepared every day? Fully prepared every day. Let me tie some concepts together. Naren, you've heard me say that the stronger a practice is in terms of being relationship driven, the more successful they're going to be when they resign from PPO plans.
Yes.
In fact, in the 6 steps, we have a 6-step plan to successfully resign from PPO plans. And that 6-step plan is literally like a blueprint. You've asked me before, based on audience questions, what step is most important? And I always say step 5,
yes,
which is elevate the relationship-driven aspect of your practice. And right behind it, I say literally right behind it, right on its tail, is step 2, which is master digital marketing, because you have to replace any patients you might lose, and you have to replace the historic flow that has come in from the PPO plans. But in my opinion, the most important one is being relationship driven. And so now I'm going to bring in this concept of, are you fully prepared, in terms of every day? Are you fully prepared? Did you do your homework? Did you do your preparation to be prepared to treat the patients that you're seeing today? And I mean, not just clinically, but I mean on a behavioral level. Do you know who's coming in today? And I don't mean just their name on the schedule. Are you prepared to interact with them and connect with them? And I'm going to suggest that most doctors will say, yes, I am, because we do a morning huddle and we prepare. Yes, I feel like I'm prepared. But then when I go a little bit deeper and I say, show me where your digital note card is. The digital note card is the idea of having literally just what I'm describing, a digital note card that has all kinds of personal information about your patient: spouses' names, kids' names, dogs' name, hobbies, interests, what college they went to. Maybe we know that Linda is taking care of an elderly mother right now. And if you have that card, the second question is, are your team members contributing to populate the information on that card? Naren, I think it's very safe to say that sometimes patients will communicate all kinds of information to our team members that they might not communicate to the doctor. Is that possible?
Correct. That is possible, Gary.
But so our team members entering that information into the digital note card. And then furthermore, are you reviewing those digital note cards before your day so that you're fully prepared? And so are you fully prepared? Are you fully prepared to see the patients that you're seeing today? And what I'm going to suggest is a very simple thing to do. And it requires some discipline. Discipline's another important ingredient for success. So it requires a little bit of discipline. Doctor, come in 15, 20 minutes before your morning huddle. I know, you may not all be morning people. I get it. But discipline, man. Come in 15, 20 minutes early. Look at the patients that are on your schedule, the ones you're going to see in hygiene, doing exams, and the one you're going to see on your restorative side, and pull that digital note card and do your homework. Put that information in your short-term flash memory. I mean, that exists in your brain. You know, recently, Naren, you've heard me say this, but I want to repeat it for our listeners' benefit. A client of ours, an older client, said in a moment of true confessions, he said, Gary, I'm finding it harder as my practice grows and it gets larger. I'm finding it harder and harder to remember all of my patients. Now, Naren, can you recognize that as a possibility for any of our listeners?
Absolutely. Even I would say the same thing. Like, I mean,
Sure.
remembering 3 people maybe, but remembering all 30 of them.
And I said, you know, doctor, I can understand that, but I want to share something with you that may give you a different perspective. I said, you don't have to remember all your patients all the time. You only have to remember the ones you're seeing today. And his eyes, I wish you could see this. You know, I know this is audio, so you're not seeing it. His eyes got as big as saucers, and he said, I can do that. And I could see that the light bulb went off. The light bulb went off. Because if you do your homework, and it's me, if I'm your patient, I'm your hygiene patient, if you do your homework on me, you're going to come into the hygiene exam. Gary, it's good to see you. How's your wife, Therese? And how's her yoga studio? And I have to ask you about your grandson, Kanan. How's Kanan doing? And, that's the information that's going to be on the digital note card. And by the way, I'm going to say something that I don't think is going to apply to any of our listeners. If you don't actually care about your patients, don't do this.
Right.
But I don't believe that statement applies to any of our listeners. I know you guys care about your patients. Show them, demonstrate it.